Live on Your Health, making a case for routine vaccines. Health officials say they are the best way to protect children from 16 harmful diseases. Here to explain this morning is Dr. Vandana Madhavan, Clinical Director of Pediatric Infectious Disease at Mass General for Children. Good morning.
Good morning. How are you?
Good, Doc. As you know, Massachusetts, we do have one of the highest vaccination rates in the U.S., but it's not 100%. Do you think that's a problem?
It absolutely could be, yes. I mean, overall, we have wonderful rates, but if we look at it at a county level and especially at a school level, there are definitely pockets where children in kindergarten, middle school, high school, et cetera, are falling below the level of what's needed for herd immunity, a high enough level of population level protection to protect everyone. So a case of measles, for example, in a school with suboptimal protection could cause a localized outbreak.
That's good to point that out. And do some childhood vaccines have more side effects than others?
Different side effects. I think it's first of all important to remember that the vast majority of children do very well. Serious side effects are extremely rare. And the vaccines vary in terms of some might hurt a little bit more than others for that first 24 hours. Some might, are a little bit more likely to cause a fever that resolves again within 24, 48 hours. Some might cause, a delayed fever a couple of weeks later. But again, remember, it's important to remember that these symptoms are self-resolved, easily treated, mild, and serious effects are extremely rare.
Vaccine hesitancy, a real thing, so that's good information. Some of these vaccines, they require multiple doses. So if a kid misses one, what are your options?
So the CDC, in addition to having schedules for routine immunizations, also has schedules and advice about catch-up vaccinations. So an older child who might have missed, a dose, as an infant might only need one dose to be caught up or might not need any if, a child is much older. But there are very clear guidelines based on the vaccine and the age of the patient as to what the catch-up schedule would be like. And also remembering that certain children, because of underlying health conditions that may, raise the risk of certain infections, might require additional doses beyond the routine series as well.
Okay, thank you, Dr. Madhavan. Parents, keep in touch with those pediatricians. It's important.
Absolutely.